All right, so I think that you can get insurance to cover this for you. Usually the weight that we remove isn't like a huge weight amount, but it's a bit different. And obviously our goal is to help those rashes for you, right? But you're gonna feel a lot better. They're conscious and things like that. I didn't feel any specific pinpoint hernia area. Sometimes when we go in there, we do find things that need to be repaired. And so we have these two muscles that come down here called the muscles. And what covers muscles and muscles is something called fascia. It's this white, thick tissue material, okay? And sometimes after we have babies, that fascia spreads, okay? Because that area spreads out when we have babies, and then it comes back together. But sometimes, it only comes together so much.
Okay.
And if that looks really loose, Dr. Huntley sews that up. He plicates it.
Okay.
So the surgery takes about 2.5 hours for all that work. You typically go home the same day.
Same day, okay.
We will prescribe pain meds, but we don't refill them. So once you're out, you're out.
Okay.
You could supplement right away with extra strength Tylenol. Okay. The thing is, when you have to tighten the muscle or do any hernia repair, is much more painful than just the paniculectomy. The paniculectomy, the extra skin itself, that's uncomfortable enough. That's painful enough. But when you have to plicate that muscle, you feel it. Every time you try to breathe, you feel a pain. Every time, you don't realize how much you use your abdominal muscles until there's stitches in them. Yeah. So I just want you to know that it will be painful and it's expected. And the pain meds really only help the pain so much. So you gotta go, if you want that repaired, you gotta go in with a mindset of knowing, yes, it's gonna be painful, but I'll get through it, right?
Yeah.
You know how they say like pain doesn't kill you?
Yes.
But easier said than done. Right. So, by the 4th day, the pain is usually starting to be a little more tolerable. But day of and after 3, it's pretty tough, okay? You got to kind of roll out of bed and push with your arms. You can't use your abdominal muscles to get up. You gotta sleep on your back in bed for the first week, pillows under your knees and prep behind your back. I don't want you staying in bed all day, okay? It is important to get up and walk around your home and do deep breathing so you don't get pneumonia or blood clots.
Okay.
If you have trouble breathing or severe leg pain after the surgery, if your leg is red, swollen, warm, hot, sign of a blood clot in the lung or the leg, you go to the closest emergency room, okay?
Okay.
I would go over all this again. This is not the only time you'll get this information, okay?
Okay.
Also, all the important stuff, we write it down for you to take home.
Okay.
It's not written, it's typed, but, so, you need someone with you 18 or older for 24 hours after surgery, okay? We have to put drains in. You'll get 2 of these, okay? And they stay in, as long as they need to. The average time they come out is around 3 weeks.
3 weeks, okay. I think I had that before.
Yeah, maybe. So as long as you have these in, you'll have antibiotics to take.
Okay.
Okay. So you have a part that's in the surgical spot, and then this tube, this part, the hub, comes out of the suprapubic area, just above the labia, and that's stitched into place. Okay. And you wake up, you'll have a binder on your abdomen to help with compression and to minimize the amount of fluid collecting in that open surface area that we've created. So we usually pin this with a safety pin to the binder. Okay. I've seen people accidentally nick their tubing with a safety pin. So just be careful that you don't do that. Okay. And when you're home, keep these covered with a big shirt so that they don't catch on the arm of the chair when you're standing up, or the cap doesn't try to play with them, okay? So you want this bulb compressed as tight as possible, and it's gonna be your job to strip this tubing 4 to 5 times a day, or anytime you see that this tubing is filled with fluid or material. You will see hunks of fat in here, tissue, flesh, blood clots. It's normal. You're gonna see bright red blood at first, and then it turns brownish, like a tea color, and then eventually yellow clear, okay?
Okay.
So if you notice this is full, you don't have to wake up at night to do this, but in the morning time you might have to strip it a few more times to get it clear. So you pinch it with one hand, and then you pinch it with the other, and you go down the entirety of the tube, okay? sometimes the tubes are really long, so what you do is you go as far as you can go, and then you move your hand down and keep going, right?
Mhm.
I've shown this to people for over 4 years, it hasn't broken yet. So
Okay.
these tubes are tough.
Oh, okay.
But they can get damaged in other ways. So you empty this bulb at least once a day, but more often if it's filling up with fluid or air. You
Okay.
open it up, get to an eye level with it, write down how much is in there, okay? And then you could squirt it into the garbage, the toilet, the sink, wherever you want to dump it, and then you're gonna re-squeeze the bulb, and then you'll have to restrict the tube so that that tube is as clear as possible, and the entire device is on as much suction. Sometimes the tube stays flat, and that's okay, it's still gonna work, okay?
Okay.
So you don't ever inject fluid into here, okay? You don't take this apart. All you do is open it up, empty it, and strip it, okay?
Okay.
Sometimes material gets caught in that flute area, and it'll still work, so don't feel like you have to take the tubing and bulb apart, okay?
Okay.
No showering for the first week. Sponge bath only for necessities, okay? You have to walk a little bit crunched for the first week, but you definitely have to sleep beach chair position for like 6 weeks. Compression garment, 6 weeks.
6 weeks.
Okay? We provide one binder for you. That binder gets gross and it has like drainage on it, old blood and stuff. You're going to want to get your own binders. Check on Amazon, okay? Look for abdominal binders, abdominoplasty binders, or paniculectomy binders. There's going to be a bunch of options.
Okay.
Just read the reviews. Get a couple of them. You want something that fits you snugly now, because if you get it too small now, it's going to be too small after surgery.
Okay.
And when we provide that binder for you, if for some reason the binder folds or is digging in an area, please fix it. You don't have to leave it like that. We do want everything to stay as sterile as possible, but we don't want you to get a pressure sore from it being folded over, okay?
Okay.
If you empty that bulb and 10 to 15 minutes later it fills back up with bright red blood, call a plastic surgeon on call, because that can mean an active bleed's going on. You have to go back to the OR.
Hold on, if it's 15 minutes?
Yeah, so like let's say you empty the bulb, you squeeze it and everything, and then you notice 10 to 15 minutes later it's filled back up with bright red blood, call the plastic surgeon on call.
Okay.
Okay? So once I write my note, we can submit the information to the insurance company for coverage, okay? If you haven't heard back from our office in about 2 weeks, give us a call and just see how the process is going, okay?
Okay.
As long as insurance, whatever the answer is, yes or no, we'll call you and let you know. If it's a yes from the insurance company, you pick your surgical date, tentative surgical date. You'll come in again to see me for what's called a history and physical, and then I'll bring Dr. Huntley in, and he'll examine you. Similar to today, it shouldn't be as long of a visit unless we're waiting for him, okay?
Okay.
And the ultimate decision lies with him, okay? He's the one taking on the responsibility. I don't think he would say no for any reason, but if he has a reason, it would be a good one. So I just don't want you to be completely heartbroken if he says no, okay? What questions do you have for me?
Like now I have to lift my stomach. When it's done, it will be not, skin still be lifted, or it will be all?
I'll draw a picture for you to give you an idea, okay?
How many can you remove?
How many what?
How many can you remove?
What do you mean
How many
how much weight?
Excess can.
So anything that's hanging right now shouldn't be hanging after. Okay. How much exactly it's gonna be, it's hard to tell. You're probably gonna feel pretty tight. Okay. I do notice that people tend to lose a little weight after this surgery. I don't know if it's because it's tighter, so it's more challenging to eat as much, or if it's like you're like, yeah, this looks great, and that gives you like a boost. Some women want this done again in the future, and that's a cosmetic fee because insurance won't pay for it again. Okay, so I'm not an artist, okay? So let's say this is the belly with the extra skin. Breasts are up here, okay? Here's your ribs, right? Belly button, legs, okay? So we lift the skin and we do an incision from hip to hip, okay? And we cut down till we get to the layer of the muscle. And then we trace that up and we cut around your belly button, okay? There's always a risk that you could lose your belly button. I don't think you will, you're not
I
that
don't
big.
think I have one right now. I don't know if I have
Well,
one.
I think it's just stretched, right? But we try to reposition it and then we track up until the rib area. If we need to sew the muscles, we sew them, okay?
Okay.
And then we pull down the extra skin and whatever's gets to this line here, we'll cut off,
Okay.
okay? And then we sew it, right? And we try to put the belly button back to where it belongs. We sew that into place. And then we sew along here, okay?
Okay.
And then the drains are coming out here.
On the two sides of the leg.
Not the leg, the mons. It's the mons, right?
Okay.
Okay. The sutures are underneath the skin, except for the belly button. Some will be on the surface. That'll get trimmed around 2 weeks. But underneath the skin, they're absorbable. They take 6 to 8 months to fully absorb. Sometimes the body tries to push a stitch through the surface of the skin, and that's not uncommon. Okay, it's not a big deal. You come in and see me, and I'll trim it. Okay. So it is normal to have sensation changes to the skin after this surgery. Increase or decrease in sensitivity or a numbness. Some will be permanent. You're probably going to have some permanent numbness in this area, but it takes 6 months to a year to improve, okay?
Okay.
We worry about tissue breakdown. So you could have some superficial skin loss. If there's blood supply compromise to the skin, you could have an area of it break down and die. And if there's a complication during the healing process, we're going to keep an eye on you and make sure you're healed before we send you on your way, okay?
Okay.
We worry about infection. So it is normal for the body's temperature to elevate immediately after surgery. The first day or two, your temp might be up a little bit. Infection after surgery usually is starting 7 to 10 days after the surgery. Overall redness, increase in warmth, pain, swelling, worse than what you had initially, that's a sign of infection. You call us and let us know, okay?
Okay.
We worry about bleeding. We talked about if the bulb fills up with bright red blood. Seroma, that's a fluid collection. That's not a bloody collection, but a fluid collection. If the drains come out too soon, you could develop an area where there's a fluid collection. We'd have to insert a needle to drain it or open it up and let it drain, okay? Need for revision, I always add that onto a consent form. Because 1, you might want this done again in the future. 2, if there's a complication, we have to revise things like that, okay?
Okay.
Do you have any questions for me?
Not really.
It's a lot of info.
Yes.
So this is that number if you want to try to upload those photos, okay?
Okay.
It was good to see you again.
Alright.
Thanks for coming in.
Thank you.
I love you all.
And then you can, maybe when it's closed, you can tell me what to buy. Or something to buy.
Right, it's mostly those abdominal binders that you're gonna look at on Amazon and get a few of them and chime on ahead of time, okay?
Okay.
All right. It's good to see you. Have a good day.
Thank you. Bye.
Bye.
Okay. Just pray for me that I get it covered by the insurance and I can get it done once and for all. And that'll be it. So I don't know. Right now they're gonna submit a claim. Submit a claim to the insurance and we're gonna take it from there. So hopefully I can qualify for that. See you guys later. Living my best life, guys.